Do you ever feel like your mind never switched off? Constantly worrying about exam deadlines, finances, or the future? Even when things are going fine? That's not just overthinking. It could be a sign of generalized anxiety disorder or GAD. I am Sanntonuu Mandal, clinical psychologist and graphologist. In my practice, I meet many students and working professionals who live with this invisible weight every day. Today, let's break it down. What is GAD? How does it affect daily life? And most importantly, how can we overcome it? Generalized anxiety disorder is not the usual stress everyone feels. It's when anxiety becomes chronic, excessive, and difficult to control, lasting for at least 6 months or more. The person keeps worrying about multiple things at once: health, money, relationships, studies, or work. And the worry doesn't go away no matter how much reassurance they get. For students, GAD often looks like studying but still feels unprepared before exams, losing sleep due to what if I fail thoughts, headaches, stomach pain, or fatigue from constant tension, difficulty enjoying the free time because the mind is always on. What's next? I have seen the bright students burn out, not because they lacked ability, but because their mind was overworking non-stop. For working professionals, GAD shows up differently, worrying about deadlines, performance, or job security every single day. Finding it hard to focus in meeting because of racing thoughts. Physical signs like muscle tension, irritability, or constant tiredness. Even on weekends or holidays, they can't relax because the brain is always at work. The mental load reduces productivity and affects relationship, creating a cycle of stress. Now, why does a GAD happen? It can develop from stressful life events like academic pressure, workplace demands, or financial worries. Personality traits like being overly cautious or perfectionist can make someone more vulnerable. Sometimes there's family history of anxiety, and in many cases it's linked to changes in brain chemistry and overactive stress system. The important point is it's not your fault. Anxiety is a condition, not a weakness. The good news is that GAD is treatable. Therapy, especially cognitive behavior therapy or CBT, helps identify thought patterns and reframe them. Relaxation and lifestyle, breathing techniques, mindfulness exercises, and proper sleep hygiene reduces tension. Music and art therapies, even ragas and creative methods, can calm the overactive mind. Medication. In some cases, psychiatrists may prescribe medicines to regulate brain chemistry. The earlier you seek help, the easier it becomes to break the cycle. If you are a student who can't stop worrying about exams, or a professional who feels anxious even outside of the office, please know this: you don't have to carry this burden alone. With the right support, you can free your mind from constant worry and start living with peace, focus, and confidence again. To take your first step, book your confidential online consultation. The link is in my bio. Remember, independence of the mind is the greatest freedom. You deserve it.